Hello everyone, and welcome to Sensemaker Live. I hope that you can hear me. I hope that you can see me. I can certainly see some of you. I'm going to do a health warning. That's an inappropriate phrase. Right now, if this connection goes down, bear with me. My colleague Claudia will jump in and while I get back online with my personal hotspot. So my name's Giles Whittell. I'm an editor at Tortoise. And this is a Tortoise Thinking, but it's also Sensemaker Live, as I say, and it's brought to you by me and Claudia, who helps me edit Sensemaker every day for Tortoise. And I should say it's also brought to you by Santander, our founding partner. We don't take ads at Tortoise, but we do work with a handful of partners who, thank goodness, support the type of journalism that we're trying to do. And Santander was our founding partner, and they've been with us ever since, and we're grateful to them for their support. Very briefly, for those of you who may not have experienced any sort of a thinking before, it is central to the kind of slow news that we're trying to do. This is where we both slow down and open up by listening in a way that will remind a few people of, like me, of old-fashioned newspaper editorial conferences. But the point is that everybody has a seat at the table and we all learn from each other by listening. We have a loosely enforced no questions rule, which doesn't mean don't speak up. It means please do speak up. There's just no need to ask a question. Tell us what's on your mind. And then Sensemaker, as I sort of alluded to, is what Claudia and I and other Tortoise writers produce in email form and on our app every morning. That is our way as a slow newsroom of keeping up with breaking news. And today, Friday lunchtime, or on the East Coast of the United States, breakfast time, we felt a good moment to, especially now, let's face it, in the middle of the biggest story of the generation and the biggest shock to our health collectively and the global economy that any of us can remember, to try to pause, take a breath, take a step back and figure out what on earth is going on. Now, I'm delighted that we are joined from DC. Gail, it is DC, isn't it? By Gail Smith. Who I will introduce in a little more detail in a second. We've unmuted you, but I haven't quite finished my housekeeping. First, I should say we're recording this. It lasts an hour. You have at the bottom of your screen a participants button, which if you click, you will see and you can scroll through a list of everybody who's taking part, and also a chat button, which will open a window where you can see what other people are typing and you can join in the chat, and Claudia will be reading it along with me insofar as we can. And anybody who wants to contribute just like that can. We might ask you if you want to also raise your hand. And let's just, as an exercise in using the technology, if you click on participants and go to the bottom right of that column, you should see a blue button enabling you to raise your hand. And I'd like all of you to do that. Looks pretty good. Thank you. I was toying with asking a very personal question, and I'm going to go ahead and ask it. I hope nobody feels it's too intrusive. If you can lower your hands and then raise them again if you've had coronavirus. So a few people have, there may be some, Nico. Well, we hope very much that you're feeling okay. I have an awful fear that obviously there'll be many more who can't be with us because they are poorly. One more hand raising exercise. Do you think from your reading of the news over the last week or two that the kind of tragedy that is unfolding in an almost numbing way across much of the Western world is coming to Africa and other parts of the developing world, or the global south, however you prefer to refer to it? Or do you think that in some way they're going to dodge this crisis? People who think that it's only a matter of time before we see similar infection and mortality rates in Africa, please raise your hand. That's most of us, a good deal of us. Okay, interesting. And we'll get to as many of you as possible, but Gail Smith is with us from DC. Gail is a former administrator of the United States Department for International Development, and she is now CEO of the One Campaign, which brings together a huge amount of expertise and human firepower, as it were, to combat extreme poverty and disease in the developing world. And Gail, thanks very much for being with us.
Thanks for having me.
Great to see you.
You too.
You have called in recent days for, I think I'm using roughly the right words, a coordinated global response to this crisis, which in a sense draws attention to the fact that we haven't had one yet. Mm-hmm. First of all, is that the case, or is there a lot of coordination that we're not aware of that might be going on behind the scenes? But secondly, what, in your view, should that response look like in terms of people and institutions? Are there institutions that can be repurposed for this?
Yeah, it's a good question, and the fact of the matter is we don't have that coordinated global response yet. And I worked very hard on fighting the Ebola epidemic as one of the leaders on it in the White House at the time, and it was quite an education and quite an exercise. And I think we got to think about this pandemic as a global pandemic, right? And visas don't need passports, viruses don't.
Viruses.
And so it moves freely. So we've got to, both as a matter, in my view, of human solidarity, stand with the most vulnerable in our own countries and around the world, but also as a matter of fact, science, and frankly, our own collective security. We've got to beat this virus everywhere, because none of us is safe until all of us are safe, right? We don't have a global strategy yet. What we need is for leaders and international institutions to come together to make sure we've got, for example, a global supply chain. What does that mean? Everyone in the world is competing for the same supplies. We've got to figure that out, figure out where we need more production. Also at the national level, we've got to do it globally at the same time.
Sorry to interrupt. Are you talking specifically there about supplies of the most urgently needed medical kit right now, or supply chains generally?
No, I think the urgently needed supplies, but think about it, we're going to need it down the road also. When a vaccine comes available, or some of the therapeutics, the medicines that can really counter the actual disease, we need to have a plan for how those are going to be allocated, so that not only people have equal access between countries, but we also match the epidemiology. So we're moving to counter the virus in all the places it's spreading. We don't have that yet. Now, the UN Secretary General has come out very forcefully. The international financial institutions are tracking this closely. WHO is doing a much better job than they did in the early days of the Ebola epidemic. What we actually don't have is very many world leaders actually joining the fight. And I get that they're all focused at home, and that's necessary, but they got to look outside their borders at the same time, and really urgently.
I want to come back to institutions in a second, but let's address the elephant in the room here. Is there a risk that when the most prominent international leaders emphasize closing borders as the bedrock of their strategy, as Trump has done, first China, then Europe, then North and South, that will eclipse any talk of a global response, even if infection and mortality rates go on up in the US? or do you think that the world at large will come around to your view and a consensus that the global response is not just ethically more appropriate,
Right.
but actually more effective as well?
Look, I think there's a risk that things like that will be proposed. At this point, I'm not surprised by anything that's proposed here. But tactically, it may be necessary for countries to close borders, shut down travel for periods of time. It's not a strategy. A, because it doesn't work. And B, if you think we've seen a lot with the economic impact of this thus far, imagine what it would look like if countries all over the world say, well, we're just going to seal all our borders, nobody can ever travel again. I don't think that's at all.
Right.
So, you know, it's kind of an ideological or political point, and viruses love it when we get off on political and ideological arguments and stay away from the science. And the science shows us, along with the economics, it simply does not work.
Right. Okay. Back briefly to people and institutions. There's frankly not much help in this regard from the White House right now. There's the interesting dynamic of Xi Jinping in Beijing tentatively stepping into the space left. But there are also characters in Europe, are there not, who could take on the mantle that perhaps some people would say Gordon Brown took on during the financial crisis 10 years ago. One thinks of Ursula von der Leyen, Macron, Merkel has been praised for her response, though admittedly, principally within Germany. Do you see any particular individuals or institutions that need to step up to the plate in the next?
Yeah, look, we need the United Nations, and you know, we may think it's flawed, but it's also us, right? We're all members of it, and it's as good as we make it. But you're getting onto something really key, which is we need to reach some minimal threshold of individual leaders coming together to start to drive this. And I think you're 1,000% right. If you look at the G20 now, I mean, two of the leaders who have spoken to the global impact and also to the impact on Africa are President Macron and Angela Merkel. And that's really, really key. So we are seeing that. Obviously, the UN Secretary General is speaking to it. So that's the kind of combination we need. We need the institutions, we need the leaders who can help drive them. And we can get to the point where there are enough leaders ensuring that we all recognize that we've got to act globally and locally at the same time. I think we can get some momentum. And China, you're absolutely right. China has delivered significant supplies around the world, including to Africa. I actually think, despite all the debates and arguments many countries have with China, or what happened at the very beginning of the arrival of this virus, that China is probably interested in working with other countries also. It is just as threatened as everyone else. And we did find in the Ebola epidemic response, we actually went to the Chinese. I had the initial meeting with them and asked them if they'd get on board, and they did.
On China, do you think that the plane loads of supplies and staff are should be accepted in the spirit in which they are offered, of simple generosity with no agenda, or are they partly public relations?
Oh, I'm sure they're both. I mean, it's a contribution. There are few countries that don't have at least some part of their motivation being, we want you to know that we, country X, are here for you. So I think that's definitely at play. The fact is, China's got production capacity. They've got some things that the world needs. So yeah, we all got to be very mindful that countries play politics. There's a global competition for first place. But the fact is, if we can get countries organized in such a way that we can get the supplies where they need to go so that we can win this war. And actually, I think war is a perfectly appropriate analogy here. Yeah, we're going to have to think clearly about countries' motivations, but not necessarily let that be an obstacle to saying, well, you're just trying to do PR, so we don't really want your masks or your N95 masks or anything else.
Right. Yeah, we certainly no one is innocent of PR. Accept that.
Right.
Now, Gail, I know that you have to go roughly at the half hour, and please, if I might even waive the no questions rule, since Gail's with us. If people want to ask questions or make a point, do raise your hand. Okay, we'll come to Tess in just a second, but I want to move on to Africa next. Tess.
Hi everyone. Gail, thanks so much for joining us. It's brilliant to see you. I'm going to ask you the really stupid question, which is if you had a magic wand and you could do three things that would in the short term minimize the risk to southern countries and developing countries, and secondly kind of protect them from the inevitably sort of harder felt economic impacts of this. So, if you had your magic wand and you could swing into action and mobilize everybody to do three things, what would they be? Or you can do one, I don't mind.
No, I like the compound sentence, right? And. We just launched a campaign test that is actually focused on three things. And we don't have a magic wand, but we think we do have the capacity to mobilize a whole lot of people. I think those three things, first, there's going to need to be an urgent humanitarian response. And part of that has got to be this issue of equitable access to the therapeutics or a vaccine when it comes along. So that's number one. Kind of think about it as an emergency response for people. The second is on the economic impact. And, I know what we're seeing in the United States. We're seeing knock-on effects all over the world that are massive. Those are also massive and already being felt in Africa. Tourism is down 98%. Imagine all the people from businesses to the informal sector that just knocks out. So that's already being felt. And so the second thing would be that when we talk about the big, bold moves we need to take to protect the global economy, we're including Africa in that. There's going to be a need for debt relief. There's going to be a need for special facilities. There's going to be a need for a lot of money. The third is that I would really use my wand to get every country to go after this thing called global health security. The fact is, these viruses are out there. We know it. We've got brilliant scientists and health professionals all over the world who, even as governments aren't, are collaborating across borders to help us understand what we're seeing and what we know. We need to get every country to the point where they can prevent, detect, and respond to global health threats. We know how to do it. If you look at what's been spent on that versus what we're spending now, it's a fair amount of money, but the return on investment is much better. It's a whole lot cheaper than doing what we're doing. So those are the three things: people, economies, and let's not do this again.
Thank you. Yeah, it's a great point about the return on investment. I don't suppose you have a ballpark figure in billions or trillions for what it would cost to secure that global health security.
I can tell you that what the world was spending on it when I left the Obama administration was about $4.5 billion a year.
Globally?
Yeah.
That wasn't
so
just...
We just saw in the United States a economic bailout package that was over $2 trillion.
Right.
And that's just the United States. So, and basically it's making sure countries have lab capacity. They've got trained people. They can do surveillance. They can do contact tracing. It's all the things we're all hearing about now. And frankly, it's not that expensive. I've been in the development field for a long time. It's on par with a lot of the other things we do on development and health and education and ag and other things.
Now, at the One campaign, you focus on Africa. And,
right.
And one of the things that we all do increasingly is we focus on the Johns Hopkins rolling data count. And it's really striking, frankly, whichever data set you use, to see a continent of 50 some countries, more than 1 billion people, very, very strained healthcare systems, should we say, but at present, much lower infection and mortality rates than anywhere else in the world. And just for example, even now, South Africa, one of the biggest countries, 1,462 deaths from coronavirus so far, compared with 1,475 for Panama, tiny Panama. Is it coming down the tracks towards Africa in the way it has come down the tracks to an unsuspecting Europe and an unsuspecting United States? And if so, what can be done?
I mean, everything we know tells us that it is. If you remember, it moved through Asia, Europe, North America, and now we're seeing the same patterns in Latin America, in Africa, in the Middle East, and Southeast Asia. And like in most countries, testing capacity is limited, so the real numbers of those who are infected are probably much higher, much higher. I look at the projections also. They are now beginning to, or the data on infections that we do have, it's starting to grow at a rate, again, we're seeing all over the world, when it increases by 100 one day and 400 the next. So we're seeing that. So I think all the evidence is that this virus is truly leading a global pandemic. And Africa is just further down the road, I think, than some other regions.
Africa is.
Yeah, but it's definitely in the queue.
Yeah.
I'm further down the road in the sense that, you know, there's a lot of talk, and I imagine you hear this there, that, California is behind New York, right? We're all behind Italy. So if you imagine a queue as this thing moves around the world, Africa is definitely in the queue.
Right.
It's further back in the queue than many of us are.
And on the one hand, you have health systems with almost nothing in terms of ventilators and critical care beds per capita. On the other, as a virologist who we interviewed for a Tortoise podcast the other week pointed out, you have very young populations overall. Do you derive any hope from the fact that the virus appears to attack young people less aggressively than the old? Is that going to save Africa in any way?
Well, I think demographics, again, everything we know is that demographics matter here.
Yeah.
People with other health problems or who are older are more vulnerable to it. And I think that will probably hold in Africa. And you're absolutely right about a relatively younger population. And I don't want to in any way discount that I think this is going to have huge impact on people and their livelihoods and economies. But I think there are a few other things that Africa's got in its arsenal. One, this is a continent that has been fighting HIV and AIDS, malaria, these other diseases for a long time. And while the health systems may not be strong everywhere, there is both a increasing familiarity with sort of public health drills, if you will, what you do. And there are a lot of leaders for whom public health has been a prominent political issue for some time. So many of them are quite familiar to speaking to. Second, this is the continent that went through the Ebola epidemic. And a lot was learned from that. A lot of extraordinary solidarity came to the fore on top of all the West Africans who were fighting it. The rest of the continent deployed 900 healthcare workers from across the continent. This isn't a continent that's got a surplus. An African CDC came out of that, so that now exists. So again, I don't want to minimize the impact, but I do think that this is a continent that is very conscious of what an epidemic or a pandemic means. I think that will help it. Not every country is the same. There are a lot of countries there, but I think in the whole, I don't think this is a kind of that's going to minimize the impact or the facts. But
consciousness isn't the same thing as resilience, is it? We were talking just before the 1 o'clock in our digital green room. What a wonderful place. about the difficulty of social distancing in very densely populated areas. You think of the townships in South Africa. You think of much of urban India, which is, it seems to me, a terrible worry just from a statistical standpoint. And my colleague Barney was pointing out earlier on that so far in South Africa, Cyril Ramaphosa has had a good press. He's been praised for getting ahead of this, but our experience is that no amount of preparation can save you from a really very high death toll. So is there any hope that any of these huge areas of the global south will avoid just a horrendous human tragedy?
It's frankly hard to imagine how that doesn't happen, but I think, again, there's some other things, and this is why we as a campaign are trying to focus on those levers that can be pushed and those things that can be done that will make a difference. I'll give you a couple of examples, and you're absolutely right to point out South Africa. We are, I couldn't get a test here if I begged for it, probably.
Right.
We've got huge problems with the number of tests that have been rolled out. We just started having drive-throughs a short while ago. South Africa's already got those. They've got mobile testing facilities. They've got now teams who've got the gear, because they've got limited gear, but they've got enough of it, who are going house to house to try to track things. And there are some of the elements of social distancing that you can put in place. If you cough, don't just cough, cough into your elbow, those kinds of things, because we know that the virus is very contagious, but we also know that it spreads more some ways than other ways. I think some of those things can be done. I think one of the most important things is this notion of equitable access to therapeutics and a vaccine.
Yeah.
I think our fear is that when these new drugs come on the line, and there's a lot of really, really promising research going on, and a lot of people working very quickly, that there will be an automatic sucking sound from countries that can afford it to buy up as much as possible. And that would be grossly unfair. It's also scientifically foolish to just deploy those in some places. So we want to get out ahead on saying that when those therapeutics arrive and when a vaccine arrives, there needs to be a global plan that ensures equitable access and again, smart science.
Right.
I think there are those kinds of things we got to think ahead on. The other thing, and again, I grew to be very fascinated by this during the Ebola epidemic, and I find that I am again. We can't predict what's going to happen. We can project it. And perhaps the most powerful thing we've got is all these scientists and epidemiologists who are unbelievably nimble. I mean, I don't think they ever sleep. They are cooperating all over the world. They take everything we know every day and say, aha, do a slight adjustment of 5 degrees this way, try this, try that. So I think we will have, even as hard as it's going to be in the world's poorest countries and in refugee camps. And I mean, imagine some of these places, we're going to have a constant flow of information that helps to the greatest extent possible, helps us adapt to what might work in different settings. Right. And it may not be enough. It's one of the most exciting things that happens in a crisis like this.
Great. Well, thank you. I've really hogged your time with us. Is there anybody else who wants to put anything to Gail while we've still got her? Because the witching hour is upon us. She will be taken away by staff members. I don't know what...
yeah, they can't take me away. I'm locked in my hallway, so no.
Oh, of course. Well, if I'm allowed, anyone else want to put anything to Gail? If I'm allowed one more question, and then we are actually going to turn to one of our own co-workers who's just back from Peru. But India, I know it's not strictly part of your remit, but we're talking north of 1 billion people, many of whom in extreme poverty, very dense urban populations, as I mentioned. overstretched healthcare system at the best of times, and a very sort of confident, if I can say so, blowhard nationalist government, which will be very reluctant to admit any failings and possibly to accept international aid. I don't know. I can't help thinking that the migrant workers heading home in large numbers right now to get out of the urban centres and the communities they leave behind are also the next hotspots. Do you have a sense? You say we can't predict, but we can project. What are the projections for India?
They're frightening, and I think it goes to two things that are really needed for us to be successful. And look, I always think about what does the virus hate and what does it just love? Okay, like get this virus in your sights. It loves it when we implement policies without thinking through all the different bits and pieces, so that when all these policies were put in place here in the United States, and then we had thousands of people crowded into airports with no plan for how we were going to handle that, and just put them all in close proximity for hours on end. Not helpful. I think much the same has happened in India. There can be some debate, is this the right policy at the right time? The implementation was horrible, and I think they didn't think through all the steps, and you've absolutely got to do that. But you hit on something else that's really key here, is leadership. Leadership, you want to inspire confidence, right, from among your citizens, but you don't want to be cocky. And you don't want to presume you've got all the answers. You need to get people the real facts. And that's the way you get people when you're trying to say, here's the guidance, we all need to do this. People are much more compliant and willing to do that if they've got leaders who are speaking the truth. And so it's an essential ingredient. It's one of the things we want to be able to focus on as one of the features of the campaign, is who are the leaders around the world that are really showing what leadership is. We all desperately need it right now. I would have to say that globally, our global leadership has let us down because we did not have to be here. But you can't measure it, but it's absolutely essential to winning the fight.
Right. Louise on the chat comes back to this question of a vaccine.
Yeah.
And there's this bar that comes across my screen saying, barring my ability to read Louise's message, but does she have hope that there can be a globally accessible vaccine? You've made the point that it's extremely important, but if you put on your worldliest hat, in the real world in which we find ourselves, do we get that equitable access when the vaccine comes along? Who are the enablers? Are we talking you and the Gates Foundation? Who's going to step up and make sure that everybody who needs it gets it?
Actually, I think we all are part of that. Some of the big players in this are pushing for that, and there are negotiations and discussions that go on amongst those that are part of discovering, producing, manufacturing, selling vaccines. I think part of our premise, and one of the things we've got prominently in the campaign and we'll really fight for, we as citizens have to lay the ground to demand of our leaders that when there is a vaccine, people have equitable access globally, also within our countries. And, the equity of access also overlays on the epidemiology. Again, going back to this notion that you can't solve it somewhere and not solve it somewhere else. We actually believe there are millions of people, a quarter of the world's population is now at home. Everybody is thinking about this virus pretty much all the time. What we think is, all right, let's get organized. Let's let leaders know everywhere, and pharmaceutical companies everywhere, and some of our allies, there's some international institutions that play a huge role here, that there are hundreds of millions of people all over the planet who are demanding that there be equitable access.
Right.
Some politicians may say, oh, not so much now, they're all locked up in their homes anyway. A huge number of us vote. And I think there are issues that if we as citizens do our bit, which you're all on video screen, so am I, we're doing our part. I think our view is we've got to organize to demand of our leaders that they do theirs.
While we've still got you, Jamie Bell is saying on the chat, are there any leaders Gales thinks are acting in a constructive, positive manner? And if so, what actions have they taken? Specific, I mean, is there anything specific that comes to mind? Some names have also followed this in the chat. Cuomo and Macron, we've already discussed. Our own London mayor gets a mention. But pending that vaccine, who has shown us how to lead?
Well, I think we've named some of them, and I think you're absolutely right about President Ramaphosa taking some pretty bold steps. I look here, there's obviously Governor Cuomo, our governor in California, governor in my home state of Ohio, and by the way, 2 of those are Democrats, one's a Republican. South Korea is another place, and that, we look often at the technical side of how did South Korea do what it did. A lot of that was also leadership. So I think that's a good example. I'm having a fight in my brain because I really desperately want to be able to say there are a whole lot of leaders who are absolutely out there doing
right.
And I think the problem is we don't have enough that are doing the right thing. To be fair, I think some of them aren't doing as much as we wish they would do on the global side of the equation because they're utterly seized with what they're looking at in their own countries. And I get that.
Yeah.
But I think the fact of the matter is we've also got some leaders who are really a problem. I mean, look at what's going on in Hungary.
Yeah, of course.
That's a problem. I read the other day that Turkmenistan is making the word coronavirus illegal. Yeah, I read yesterday. I can't state that as absolute fact, but I sort of like, what's this?
Turkmenistan will always push the envelope in terms of absurdity.
Exactly.
Yeah.
And, I live in Washington, and there have been some very interesting things said and done here. I think we'll see those leaders emerge. And again, one of the things we would like to do, it's really easy to criticize those who are screwing this up. And it's very tempting to do that 24/7. Part of what we want to do is shine a spotlight on those, both political leaders, but others who are really leading like leaders. And that's one of the things we hope to be able to focus on down the line.
Right, great. Well, Gail, thank you so much. If you have to go, that's fine. If you can stick around, that's great too. We've got about 20 minutes to go. And let me just remind everybody, this is an opportunity to talk about whatever's on your mind. We have had one big story on our mind for the past month, but it is composed of hundreds of little stories. So if there's anything that you want to bring up that you think we should be reporting on in a deep way at Tortoise, or just covering so that we've covered it in Sensemaker, do let us know. Hester, you've raised your hand, so let's come to you, Hester, and then afterwards, if Ellie Pogrund is around, we'll come to Ellie. Hester.
Hi, hello. Yeah, can you guys hear me?
Can certainly hear you.
Okay,
we might be able
great.
to see you soon too.
Oh, no.
Oh, you're on your
If
phone.
that's okay. Yeah,
That's
I'm on my phone, and yeah.
That's fine.
So sorry. One of the things that's on my mind is, I mean, I guess it's slightly separate to the global conversation, but just from being a citizen in London, is the hostility that's out there at the moment. So while we're being told to self-isolate and social distancing, I'm noticing a real horrible social drop in anybody speaking to each other on the streets. Buying food, you might have to stand 2 meters apart from each other, but it doesn't mean not to speak. It doesn't mean not to look in the eye. But what I'm seeing is people are really scared to even speak or look people in the eye. So that's a point I wanted to raise. From I live in Islington in North Central London. That's the feel here is, and this is quite a nice part of London, to be honest. And even there, things are very strange outside. So I guess kind of I'm doing what I can to try and make like an active effort to keep talking to people. We can be distant, but we can be friends. If we're going to have a global effort to try and reach to solve this, what we don't need is neighbours falling out with neighbours or nobody speaking to each other anymore.
Yeah, there's almost a sense that if you talk too loud, something will land on the person you're trying to be sociable with. No, I sense that too. James, I've heard of you. James Harding, you've got your hand up.
I have, although I see Gail's waving at you, so you may want to go to Gail first.
Just
Gail,
quickly, I just wanted to, I'm going to have to take off, but can I throw out one thing as I do?
Absolutely.
Two things. Thanks for doing this. Like, this is great. But the second, to the woman who just talked about this weird hostility, I think we need to call it physical distancing, because actually we need to be socially close. So I'm trying to call it physical distancing, because I had the same experience. I felt like this, I passed somebody on the street, we both felt like we were being rude. And we sort of apologized and said, well, let's call this physical distancing.
That's a great point.
So thank you so much. I apologize that I got to take off, and my apologies to your colleague who's been in Peru. I'd love to hear more about it.
We'll pass on the gist of it. Thank you so much for being with us.
No, thank you.
Thanks. Where were we, James? You had the floor. Can't hear you.
I'm being unmuted. I'm unmuted.
Yes.
There we are. I tell you what it was, Giles. And I know we were talking about this a bit on the phone this morning as you were kind of working on Sensemaker, but it was just listening to Gail struck me that, you know, when we started thinking about the internet, the expectation was the internet was going to be this great leveler. And then in the first couple of weeks of coronavirus C19, we had the same thing. It was going to be this leveler. And then actually we'd begun to discover quite how much it exposed economic discrepancies and differences. And then in the last couple of weeks, there's been this idea that actually it would be, if not a leveler, it would be a forcing mechanism for bringing countries together, a new realization of the necessity of global leadership and collaboration on a sort of planetary scale. And I guess the thing that I wanted to do was just make a point that in the last 48 hours, I've become much, much more concerned and alive to the idea that actually national differences and national divisions look likely to get much more stark. And the reason for this is I was on a call yesterday with someone who was talking about sourcing both the molecular testing equipment and the antigen testing equipment and ventilator components. And what they were saying was the real problem we've got here is there are only a handful of companies that produce this stuff in the world, you know, Abbott, Thermo Fisher, Roche. But even they require certain components, and the country that provides them is China.
Right.
And so suddenly the rest of the world is literally scrambling over each other. As this person said, you know, we bid for certain products and then found we were gazumped by the Italian and Spanish because they so needed them. And so there's this really, I think, quite heartfelt concern about the extent to which nations can take care of themselves. And overnight, a friend of mine who lives in Shanghai, we were in Shanghai together, sent me a note about a Chinese person who was spat at on the bus here in the UK. And I thought there's something really profound that's going to happen here, a sort of kind of policy level argument about the extent to which countries can afford to be reliant on each other, which is a shorthand for how much is the world happy to be reliant on China, and then a social division, which may take the form of kind of Donald Trump style political positioning, but might be much more common than that. And so, sorry to sort of strike a slightly downbeat note at the end of the week, but I suppose what I'm saying is, having thought, well, maybe it's a leveler or maybe it's a globalizer, it strikes me increasingly it's neither of those things.
I fear you're right, although I'm a naive optimist at heart, and I can't help thinking that there's going to be an extraordinary bounce back to business as usual in many respects at the first opportunity, some of them good, some of them bad. So I think we will go back to being social. I think we'll also go back to being horrendous polluters. But I don't want to miss the chance to go to Ellie because we were talking about Africa, we were talking about India, but there's also South America with stronger health systems, but also and a lure to many backpackers, one of whom, Ellie, you became after working with us at Tortoise. There you are. There you are. And you got a bit stuck in Peru, right? You're right in the belly of the beast. What happened?
So I was in Cusco. I was 2 months into traveling. I actually booked to go on a hike at 5 a.m. to Rainbow Mountain. And I woke up that morning and we got told that a lockdown had been announced for 15 days, which has now been extended to a month. And you could only go out for 3 reasons, which was to go to a pharmacy, to go to an ATM, or to go to a supermarket. And so from that point on, I was stuck in my hostel, which was 150 people. It was actually an Irish party hostel, which made it a little more entertaining than maybe being stuck in London. And so, yeah, I was there. And then actually, so I got back on Tuesday, but about 3 days before, the hostel decided to close because they were worried that the police would raid our hostel and force everyone to get tested. And if that was the case, we wouldn't be able to get our repatriation flights home. So then,
what was the system? If you tested positive, you wouldn't be allowed on a repatriation flight?
No, so the tests I was told could take like 5 to 7 days.
I see. And
so they knew that there were about 50 Brits in our hostel, and we were all waiting on our flights that week. So they didn't want it was to help us. That's what they told us. So they didn't want us to be in a situation when we were stuck and we couldn't get home. So they
while you were there, were you literally not allowed out of the hostel?
We were allowed out every 3 days, and we had to write down why we were going. If you went to the supermarket, they would like take your temperature. Only a certain number of people were allowed at a time, and you had to wear a mask when you went to the supermarket.
Now that is completely fascinating. All right, this is a country that we think of as perhaps less developed than our own, but you had your temperature taken, you were required to wear a mask, they had organized social distancing at the same time or earlier than we did. Did you get the sense then that Peru was, if not a rich country, then an organized country?
Yeah, certainly. And it was interesting as well because the number of people with coronavirus was so low when it started. I think there were 80 people were there, and I think about 60 or 70 were in Lima. So I expected that after the lockdown, everything would carry on as normal. And I was thinking, oh, I'll just wait it out and then I'll continue my travels. But obviously everything changed so quickly. And the other thing I noticed was that the police were pretty scary. Like if I were out, they would sort of blow their whistles on their bike and come by, and it was just quite scary. I wouldn't want to be near them. My friends actually got arrested by them when they were just going to the supermarket, and they had to go to a police station for 3 hours. And I think as sort of what James was saying, as we got towards the end of the quarantine, there was definitely sort of anti-tourist sentiment because I think a lot of people in Peru thought that tourists were responsible for spreading the virus.
Okay. Now I'm going to break with protocol. And even though you haven't put your hand up, Ellie Jacobs, put it up, please, because you had a question. There we go. Or at least say what you were going to say.
I spoke to Ellie about this while she was in the hostel, which actually I've also stayed in as my favorite hostel in the world. So I think it'd be quite great to be quarantined there personally. Anyway, Ellie, at the time, this is about 10 days ago, said that Spanish and Italians, I think, correct me if I'm wrong, were either not allowed in the hostel and also were being treated differently to all others, despite not having been back to Spain in, I think you said 3 months.
Yeah, I forgot to mention that. Yes, there were 2 Spanish people who they'd been traveling for as long as I had, which is 2 months. But because they were Spanish, they were told they couldn't stay at the hostel. So they had to leave and they had to stay in Airbnb. And luckily they managed to find a different hostel to stay at. But the one that I was at, they weren't having them at all. So yeah, that was definitely a difference of treatment. And it didn't make sense either because they hadn't been to Spain in 2 months. So they were just the same as anyone else.
I've got one more question for you, Ellie, but before I ask it, let me just remind people, don't leave it till the last minute. If there are other aspects of living with, fighting, or thinking about the future of coronavirus that you'd like to bring up on the basis of the last week's news? Now's your chance. Not just in the chat, feel free to raise your hand. But Ellie, as you left,
Yeah.
You might not have been watching the data very closely, but was it your sense that Peru was heading into out of a situation of being under control into a situation of being out of control?
In terms of the virus, or in terms of
in terms of the virus? Sorry, yes, just in terms of the extent of the spread.
So yeah, the numbers sort of rose into the hundreds as I was there, and I was very surprised by it, because they've got even more strict. I was speaking to people who are stuck there still, and they've changed the curfew now. So men are allowed out on Monday, Wednesday, and Friday. Women are allowed out on Tuesday, Thursday, and Saturday, and then no one's allowed out on Sunday. So it's still ballooning massively, even though they've got very strict controls in place. So yeah, probably.
Oh, that's fascinating. Men and women on different days. Right. Okay. Now, one of the things that fascinates me a lot is not just the story, but the meta story, the coverage of the story. And Ellie, the other Ellie Jacobs, if you can stabilize your screen, I was beginning to get seasick watching it rocking backwards and forwards, I think, on your knees. Have you got a nice little coffee table there? Excellent, excellent. You wrote a piece for us this week about domestic abuse in the age of coronavirus. And the story is very well worth reading, and it's a very important one. But how difficult was it to get people to talk in those circumstances when they're, in a sense, trapped, but also trying to get them to talk and that they can't get out of the house?
Well, yeah, that was definitely something that I struggled with. And I mean, I hope you will read the piece, but one of the things that I wasn't able to access was any interviews with women that were either survivors of or currently going through domestic abuse. And that was for a number of reasons, but I couldn't speak to anyone that's currently going through it because, as you say, Giles, one of the big issues is that specialist services are seeing a dip in referrals for new cases of domestic abuse. And by that, I mean that people accessing services for the first time. So all of the experts I spoke to who work in this space were saying that they have seen an influx of either calls or people accessing online help, because often phone calls are not a luxury that those in close, private phone calls are not a luxury that those in close confines can actually get access to. But most of the people who were phoning in or going online were either survivors of domestic abuse or those that were already known to services. So one thing that was very, very worrying for many experts is the fact that there were not so many new cases. And they believe that this is for a number of reasons. But one, you know, maybe people who are going through this for the first time have no idea how to access support, particularly because GP surgeries are closing all across the country, which is one space where apparently more disclosures are made to GPs than to the police. Obviously, we all know that the police resources are being diverted elsewhere to contain the lockdown. So maybe, you know, people are thinking, well, the police aren't going to do anything because they're few and far between. And that was kind of my point about that. And another big issue with the reporting is that most of the evidence at the moment is merely anecdotal, because whilst we can look at other countries like France and China, Israel and Italy that had shown a correlation between the lockdown and a rise in incidents of domestic violence, here, because it's only been a couple of weeks, whilst police are seeing more calls, you know, you can look at certain police forces across the UK, and statistically, I think Merseyside and Avon had a reduction of calls for crimes that would normally take place out and about, but a rise of calls for domestic abuse. But again, it's too early to tell the extent of this issue. That most people are all sure that this is going to be, you know, hugely problematic.
Right. Well, thanks for grappling with it, Ellie. I've got to say, with just a few minutes to go, that we shouldn't be blind to the other side of this coin, which is a more positive one. And I want to invite everybody to think of silver linings this Friday afternoon. I'll share one with you. Normal working hours at Tortoise involve, for me, getting back after supper. So I say to my kids, what did you have? And I sit down and eat mine by myself. How sad is that? Anyway, since the start of this, I've eaten with them and sometimes even cooked for them. And actually, you know, we are lucky enough not to be, I hope, in an abusive household, but it's improved our group dynamics as a family rather than made it worse. And I'm just wondering if anyone else has experienced that, or indeed any other silver linings. You haven't seen any on the chat, have you, Claudia?
Not on the chat, but I can talk about my experience.
Oh, go on. Yeah, with your flatmates.
Oh, Tessa's planted 7 fruit trees, which is lovely. So I live with 2 boys, we're flatmates, and we have had dinner together every night, and we're playing cards, and we've not done it yet. Last night we planned to go to the theatre because the National Theatre is live broadcasting performances basically on YouTube. So we're going to do it another night. We couldn't do it last night, but we're going to all get together and we're going to dress up and have a glass of wine and watch a live streamed version of something at the National Theatre. So we're all trying to get a little bit, I guess, imaginative about how we spend our time. But crucially, we are spending a lot more time together, which is really nice. And we've got some other people on the chat saying Michelle is reconnecting with nature, which is amazing. She's just sent that to me. Carly lives alone and is speaking to friends and family more than ever, daily yoga and runs, spending time. Oh, this is so nice. Lots of people. Edith last night, nice horrible home workouts with my mum. So I guess there are obviously a lot of dark things that we're talking about, but some positives.
Right. Edmund's raised your hand. Edmund.
Hey guys, yeah, Giles, just wanted to come in on that. So I've gone home to my mum and dad in Sussex, as you can see by the kind of middle class.
Picture frames.
What do you say?
Picture frames.
Picture frames, sofas, lamps, we got it all here. I obviously spent much more time with them than I sort of usually would. I went for a quick lunch break the other day and they were playing Pelmanism, you know, that game with like pairs of birds, like the male species and the female species. So suddenly over my sandwich, I was getting involved. At the weekend, I go on a cycle ride with my dad, who's 61. I've got a sort of road bike and he goes an electric one, and that's quite a nice leveler. So we roll along quite nicely. So we get a bit fed up with each other, and you know, we sort of watch the 10 o'clock news most nights, and it's pretty dire on the whole. But I've been getting in quality time that I wouldn't have got if I was just home in London.
Right. I think a lot of people have felt things like that. And then at the same time, you suddenly realize there's someone you know well who is in critical care in hospital, and you're just hoping against hope that they pull through. So what a strange time. Thank you, everyone, for being here, whether you work at Tortoise or you're just visiting. I would urge you to keep track of what we're doing on the app. If I personally lose track of whether it is possible for you to be in this electronic room and not already receiving the Sensemaker email, but if you're not, please sign up for it. We do our best to cover everything that seems to be important that's just happened and to make sense of it, and even to try and give a glimpse of what's about to happen. Before Zoom cuts us off, I just want to try and pull together some of the threads that Gail and others mentioned, because I think I think what happens with the virus in Africa and India, and to an extent South America, is going to be a big part of the story of the next few months. A lot of people saying, what's the next big part of the story? Chris Cook made the good point that the race for the vaccine is going to be dominant. And those two stories obviously merge. And Gail mentioned several times the need for equitable access to therapeutics now, vaccines when they come. We have time to arrange that. Global leadership has given us very little grounds for confidence on present evidence that they will mobilize the resources necessary to ensure that the most vulnerable get the vaccine when it arrives. But at least it's a task that is clearly defined, and as she pointed out, probably much less expensive in cash terms than the alternatives. Gail also made the great point that we should start calling social distancing physical distancing, because we need to remain socially close. And Hester from Islington spoke of hostility on the streets. I frankly haven't been out enough to know, but as we reported in the Sensemaker this morning, there are unfortunately good reasons for keeping that physical distance really, really substantial, even more than 2 meters in my view, at least according to some of the science coming out. Thank you all very much. Thank you, Ellie, for telling us your story of getting trapped in and then out of Peru, and Ellie J for your reporting on people who really need their stories to be told and who need help that might be almost impossible to give them in present circumstances. It's now 2:02, so the witching hour is upon us. I'm going to do something that James sometimes does because electronic waving isn't much good. I'm going to go to the gallery view so I can see more of you. And I think we should end with a physical wave. So thank you all very much for coming. Join us again next week for another episode of Sensemaker Live, when we will have more mystery guests. Thanks a lot. Bye.
Thanks, everyone.